Good morning, everybody. My name is Tian Johnson. Let me just start by saying that we will activate my video in a moment. We're just having some connection issues, but we did want to be respectful of your time and begin the call. My name is Tian Johnson, and I will be speaking today with Sibongile Tshabalala for the next 1 hour. Colleagues, welcome. Thank you for joining us. These COVID-19 conversations are brought to you every Thursday at 10 a.m. by the Vaccine Advocacy Resource Group, the VARG, which is 100% funded by activists, the African Alliance with support from the South African Medical Research Council and the Department of Science and Innovation. They are also brought to you in partnership with the Community Constituency COVID-19 Front, the Treatment Action Campaign, and APHA. Colleagues, as you might know, the calls are structured in that the first 30 minutes, we will ask our guest to give us an overview of their work as it relates to some of their historical work, as well as speak to us about how they have experienced operating within the context of COVID-19. Today, colleagues, we are joined by Sibongile Tshabalala. She is the chairperson of the Treatment Action Campaign. She was diagnosed with HIV in 2000. Sibongile is not only a positive inspiration for people living with HIV, but a social justice activist on health and rights issues affecting women and the poor. In 2009, she became a member of the Treatment Action Campaign for Sloris branch in the Gauteng province of South Africa. And in 2012, she was elected as a provincial chairperson of the Treatment Action Campaign in Gauteng. In 2015, she was co-opted as a National Deputy General Secretary, and in 2017, she was elected as the National Chairperson of the Treatment Action Campaign. Her leadership and voice has helped raise awareness at local and international platforms, including the International AIDS Society Conference. She's an honorary fellow at the Steve Biko Center for Bioethics. Sibongile will be providing us with an overview of the TAC, how it has had to pivot with the advent of COVID-19, and some of the current work the Treatment Action Campaign is undertaking. So, Sibongile, thank you so much for joining us and taking time out to speak with us this morning. You know, it's been nearly 22 years since the TAC was launched on the steps of the St. George's Cathedral. So firstly, congratulations. That huge milestone is coming up. I'm sure as a collective, we're extremely proud of the work, certainly that the TAC has led. And of course, it's always refreshing to see women in leadership, something that we're very excited and passionate about. So without further ado, I'm going to welcome you again. Thank you for taking the time, and over to you.
Thank you, Tian, and thank you to the comrades, and thank you for having me this morning. I would like just to kickstart this conversation by saying Amandla. Comrades, as we all know that in mid-March, the country went into lockdown due to the alert of COVID-19. And there was a total shutdown for about 3 weeks in the country. So that time, the lockdown presented so many challenges for everyone and also for TAC. So there were many restrictions, so we couldn't work as we are supposed to work. And also remember, TAC, it's an advocacy movement that always advocate for better healthcare services. So what did that mean to us? It meant that now it's a time that we have to pull up our socks and focus more on the work that we always do to monitor healthcare services in the country. But it was difficult because all of us, we were locked down, we couldn't go anywhere, and all of us, we didn't know what is this COVID-19 that people are talking about. We're still trying to figure it out and understand it so that when we educate our communities, we know what we are talking about. And at that time, if all of you will remember, there were many announcements that were made from the government side, of which some of the announcement was that people should avoid going to the health facilities now and again so that they cannot be infected with COVID-19, which that created more problems for us or for the country. But as TAC, we felt like we cannot just sit back and say this is a lockdown, we don't know what is COVID, and we say that should be just happen. So we started as an organization to rethink on how to implement our activities and how do we come up with alternative ways. So we conducted some surveys during the lockdown of facility monitoring and in different communities. Evidence was the information that we've been getting from individuals. We managed to continue to advocate for it. And also as soon as the president announced the lockdown, our first step was to write to the minister with our partners, to the Minister of Health, yes, with our partners to say, since now we are facing a lockdown, we are facing COVID era and nobody knows what will happen, we suggest that people living with HIV or people who are taking chronic medication should be given a treatment that will last them longer. So we advise to say at least people should be given treatment for 3 months to 6 months. Unfortunately, we didn't get joy at that time, but because that's when the minister was focusing more on COVID, not on people living with HIV, not on people living with TB, not on any other chronic disease. The only disease was available or was existing in the country, it was COVID-19. So the letters that we were writing to the minister were not responded to. But as time goes by, we saw a change where during May, we have seen the minister now saying, or the circulars from provinces were sent to say people they should be given 3 to 6 months ARV medication. But that didn't help because at that time already the country started to face some shortages of medicine in some of the areas, and the health clinicians, they were scared to dish out medication as much as they can because they were scared that they might run out of it and they don't know what will happen at a later stage. So I want to talk also about the SNAP survey that we did. The SNAP survey, the first report, it was published on the 4th of May 2020, and it showed that more than a quarter of people who have responded have shown that people are not accessing services as they are supposed to access. So we had that time for more than 404 people who have responded to our survey, and it shows that in the last 30 days, which means during April and May, people were only getting at least 30 days treatment, which means it's a 1 month supply. And we have heard that so in other regions or in some part of South Africa, people were even given, they were counted pills for. So those were the issues that we were facing during the time of lockdown, and we had to come up and advocate also. So the advocacy during that time, it was so difficult because you write emails, you write letters, you will try to establish calls, you will not get any response. And when you call, sometimes they will tell you, no, we'll come back to you, and they'll never come back to you. So that was very difficult for us. It made it difficult for people to get access to treatment, to get access to other healthcare services. We have seen the contraceptives in the country, we've been facing shortages of it during that time, which it was another big challenge. Where we know that we have a problem in the country of SRHR or contraceptives, or our SRHR policy, it's good, but implementation on the ground is something else. We know that we have women who are locked down with a male who are abusing them at home. So they couldn't even be able to negotiate sex. If they were raped, children, if they were raped at home, there were no services for them at the end of the day. They couldn't prevent themselves for unwanted pregnancy. Or those who wanted safe abortion, it was a mess because in most areas it was not available. While already in the country, we have less of those services. So during our monitoring, during the lockdown, we made sure that we give most of our branches and members airtime and data so that they can be able to call patients and facilities. So about 740 communities were phoned and contacted by tech, provincial offices and comrades, and all these responded with over being 400 resolved directly to facility managers. So through those calls, we were able to do advocacy, we were able to engage on other issues, we were able to advise facility managers on other things that need to be advised on. And also, we used media to be able to spread the word and to educate communities. One of the things that we also did is we did a COVID in Our Lives booklet, which we made it easier for people living with HIV and other chronic illnesses to understand, to say, how do you survive when you have COVID, or how do you protect yourselves when you are infected with COVID. So that has helped us to try to do something as an organization. Also, because Treatment Action Campaign, our background, we known of fighting for ARVs, or known for a TL program, which is Treatment Literacy Program. We couldn't sit back and say, now because we are in lockdown, we cannot do anything. So branches where we continue to have education in branches through your WhatsApp groups, where the videos were sent to WhatsApp groups and engaged. We use this platform like Zoom to have those educations. We used Facebook and Twitter to continue to educate communities in all 7 provinces that TAC is operating. When there was we were at level 3 of lockdown, that's when we felt that we cannot sit back, because things now were getting worse on the country, on the ground, because we were not there, and we felt like need to do something. So we started to go out and engage politicians or principals and attacked most of the districts that were mostly affected. I think we all know that what was happening in the Eastern Cape and what continues to happen. The state of health there, we found out that it's deteriorating every day, and we couldn't sit back, especially when people were given medication over the fence. That also was happening all over the country. People were given medication over the fence. People who are not designated to issue medication were made to issue medication, because there were the facilities were closed. People cannot access services because facilities are closed due to COVID-19. And we also found out that in most areas, in a week, a clinic will be closed twice or thrice, or in a month. So which means that left communities or patients stranded without any support or any services, which made it difficult for patients to access treatment. So let me go back to the issue of Eastern Cape. Eastern Cape, we know that there were challenges. Community healthcare workers, they tried to march, and they were brutally shot at by the police and the government, and nobody took responsibility for that, which TAC was part of the people or the organizations that were supporting those marches, because community healthcare workers were exposed to all the dangers of COVID-19 without any protection, without any risk allowance. And they were forced to work more hours without any recognition. So as much as we know that they are frontline workers, one of our advocacy issue, it was that they need to be equipped with PPEs, which is personal protective equipment, and they need to be given all the tool of trades, and they need, if they are infected with COVID-19, they were supposed to be given time to go for quarantine until they are better. But what we have found out on the ground is that that was not happening, and it has disturbed so many people. As we are speaking today, many of community healthcare workers have lost their lives, and we don't have those numbers, and we don't know how many of them were infected and died along that struggle. And nobody also now is recognizing them, including our own government. We only know of Gauteng that has absorbed them as frontline workers, and now they are they are permanent. They have a permanent contract. But then what is happening in other provinces? Why they are in the same South Africa, where our constitution says in section 9 we are all equal in the face of the law. Where is equality when it comes to the community healthcare workers? So that is one of the things that we've been pushing and we've been fighting for community healthcare workers to be recognized and be given all that is due for them as workers, as labor law is stating. In the midst of everything that we were doing also, we couldn't drop the ball on the issues of intellectual property. If you remember, since the early days of TAC, intellectual property, it's been our baby. We've been focusing on the intellectual property bill. Over the years, we've been marching the DTI to call for a change of the bill of the change of the DTI of intellectual property policy. We know that in 2016 the bill was there. We have a draft bill in the country. Up to today, we still have that draft bill, which means our intellectual property on medicine is not regulated, and which means that pharmaceutical companies are still taking advantage of the country, and especially in South Africa. And lately, when I'm still talking about intellectual property, South Africa and India have been calling for change in the agreement, in the TRIPS agreement, and we've been having engagements with DTI due to that way before the South Africa signed that. We want to congratulate the president and the Department of Trade and Industry on pushing for the TRIPS agreements to be changed and be discussed, so that it will be able to accommodate all the countries, including the ones like South Africa and India. Also, I would like to talk about the month of action. TAC in August, we have declared a month of action. The month of action is very exciting. It reminded some of the long days when we were fighting for ARVs, where we were monitoring facilities, and after that we just go to the Department of Health and march there and raise concerns from the communities and take the people who are directly affected to the principals so that they can listen to them, which made the advocacy to be very exciting at that time, although we haven't reached our goal as we want to reach our goal. We managed to have big marches in the Eastern Cape, in the Free State, and in Mpumalanga, where communities were taken from the community to the department's office without any appointment, without any engagement. We just patch in and say, and we received a positive response, because up to today we are still in engagement with some of the district managers and provincial MECs, where they are engaging TAC and PHIV sector on the issues that are coming on the ground. So currently, what are we focusing on? We are focusing on the issue of facility monitoring. Maybe all of you, some of you, you'll remember that we have a project of people living with HIV, which is first in the country and first in the world. And we are working very hard as a PHIV sector to make sure that that project is recognized, and it's recognized that it started in South Africa by people living with HIV, and we manage to show the world that we can do it as people living with HIV. So what are we doing? We are with that project. That project, we are monitoring 400 sites that are funded by APHA in 27 districts. We have managed to hire about 156 people in the project in 8 provinces. So we are monitoring to say the facility manager, how is the facility manager think about the services that they provide on the ground. We monitor we observe how the state of the clinic, talking about infrastructure, the windows and other things. We also talk to the data capturer. We also talk to the patients to say what is their experience and what will they like to see happening. So after doing that survey at the clinic, then we have community engagements and door-to-doors, where we engage communities on the findings that we received from them in the facility, and if there are additions and what they think or possible solutions on how the facility can be run. Then we also take that also back to the facility manager and have that conversation. And it starts at the community level and then goes to the provincial level, to the district level, to the provincial level, up to the national level. So we have been engaging with all the service providers on the ground, which some of them, they are welcoming this project because at least it gives them a picture on how people are thinking and also how people want services to be rendered to them, which is very exciting, and it makes our lives very easy. Also, as PHIV sector, we are now this year part of, we want to acknowledge that we're part of the World AIDS Day. The concept note, we were part of the writing of the concept note. We are engaging with SANAC, the Office of the Deputy President, and other stakeholders, Department of Health and other stakeholders, on how we want to do the World AIDS Day differently this year. We know that COVID has disturbed us a lot, but that between that disturbance, we know that there were challenges. So we want those challenges to be addressed. One of the challenges that we want to be addressed is the issue of loss to follow up. We know that we have, like for instance, in April, here in Gauteng alone, 11,000 patients were lost to follow up. So were lost in the system. So how do we bring back those people back to the services? How do we utilize or implement correctly the welcome back service that we've been calling for as people living with HIV? To say people who are coming back to the facility, are they welcome? Are they treated well so that they can be able to stay on treatment? And also what we have been calling for, it's a psychological support for people living with HIV, because some of the people are lost to follow up, not because they are scared to go to the facilities, but you know, almost all of us who were frustrated during the lockdown. It was the first thing happening where everybody's locked down. Just imagine a person living with HIV locked down without food and all those things. So there were a lot of psychological challenges that people have been facing, so which made some of them not to continue to take treatment. So in the World AIDS Day, what we are planning is that we want all political principals to go on the ground, do door-to-doors, talk to patients, talk to people living with HIV on the ground, go visit facilities unannounced to say we are going to this facility, and they should see what are really challenges that we are facing on the ground. We know that sometimes they do their clinic visits, but it's different because in most cases they announce that we are coming and the clinic will be clean. Everybody will make sure that everything is up to standard, everything is well, and the facility manager will give a good presentation to say this is how we are doing the job as a facility, which is not a true reflection of what really is happening. And we understand the side of healthcare workers when they are giving that good side. It's because no one can bite the hand that feeds him or her. So it's difficult to tell your employer that I cannot do the job, or it's difficult to do the job. So you want to be seen as you are trying. But when you go to the community will tell you exactly what are they experiencing, because they are the ones who are frustrated. So this year, the plan is to work with the government and go to those facilities, and they should see and hear for people to hear from patients who are living with HIV to say what are their struggles on the ground. And after that, we are calling for implementation plan that will be able to be cascaded down to the ground, because as I've said earlier, that in South Africa, we are very good at writing policies, we are very good at writing these plans, but the implementation is something else. So that's what we are calling for implementation to happen on the ground, so that we see that people are getting services as they want to. So that is few of what we are currently working on. Also, we are continuing to engage principals and MECs and HODs and district managers where there are still challenges. But there's one thing, comrades, before I close, that I want to talk about, which it's a big challenge now, and it's been a challenge, but we've been talking about, but there's less that is happening. It's an advocacy on the issues of HIV people who are now having cancer. Cancer is a new pandemic, and cancer it's killing so many people, and nobody is saying anything about it. And cancer services are not there on the ground, or are very minimal, of which it makes people to die while still waiting for services, which is very problematic. Also, comrades, I want to talk about the issue of TB. TB, as much as COVID has killed so many people in the country, but when you look at the numbers, or you can check the statistics, TB has killed more than twice the number of people who have died of COVID-19, and TB continues to kill people on the ground, but there is nothing there's nothing from the government or a commitment. So as people living with HIV, now we are calling for a government to declare TB as an emergency, so that TB can be given as equal attention as it was as COVID-19 it was given, because TB is killing people, nobody is talking about it. But COVID-19, because it affects everybody, it kills everybody, everyone wants to fight TB. Also, lastly, I know I have been saying lastly for a very long time. With me. Lastly, I want to talk about the advocacy on COVID-19 vaccines. We know that there is something that is happening, but we don't have so much information on that. But also we know that the government officials or the principals, they are getting some vaccine. So we are looking at that. While we are looking at that, we will need also to advocate for people on the ground to access COVID-19 vaccine. Lastly, COVID-19 kills people. People are still dying, and people, they should protect themselves. But I want us, comrades, to look at the people who were infected with COVID, and they were quarantined. They were some of them were hospitalized, but after COVID, they still have challenges. What are we doing about that? And what could happen if now because last few days I heard about something called long haul COVID, which means a person, even after the person survived it, but the person continues to have more sicknesses like short breaths and other things. So physically the person cannot work properly, and the health continues to deteriorate. So in those words, comrades, the struggle continues. We are not there. We haven't won the fight, not yet. Uhuru. Amandla.
Amandla, comrade, thank you so much. As usual, I mean, I think the attack keeps on just taking our breath away in terms of the breadth and the scope of the work you do. And I think the ability to also straddle those very complicated lines between what is happening on the ground, right all the way up to these global, hugely influential and powerful bodies like COVAX, which we, you know, as civil society have certainly been pushing for. We've submitted nominations for representation. We've advocated to ensure that in these powerful platforms, voices have to be heard, communities have to be there. I mean, it's interesting to hear you speak about loss. To follow up, a mutually close friend of ours, Martha Tolana, an amazing activist. I recall that when they had said she was lost to follow up. She said, we are not lost to follow up, but we are bullied out of care. So that's something I really enjoy remembering from Martha, your reflections on GBV and sexual assault and all of these intersections and how they impact your work. The month of action, we're certainly excited to hear about. And I think in particular, these unannounced visits by political leadership, I think have the potential really to inject that kind of excellence that we've been looking for. I think I wanted to pivot and then ask you to link to your comments around cancer. What has your experience been as the TAC engaging with the existing cancer movement? So for those of us outside of the space, we think of cancer, we think about all of these organizations that from the outside seem to have pretty impressive coverage and reach. What do current partnerships look like between the HIV, TB, STI space and the cancer comrades?
Yeah, quickly, if I may respond to that question, Tian. Yes, partnerships with, like for instance, TAC has a partnership with Cancer Alliance. But the challenge that we still have, the way of doing things, remember, TAC, it's not, as much as we do writing advocacy, writing those letters and all those things, but we believe in doing things on the ground, things physically, and we believe in pushing. So the boardroom advocacy, it's not for us, and it doesn't talk to us. So in most cases, when we want to engage issues, then we are bit disturbed because the people who have to be in the forefront, they believe in the boardroom advocacy. They believe in banging tables in the boardroom, while we believe that we should hit the street and make noise until we are heard. So there's a lot, and also the like cancer groups are not they, as much as they are organized, but they are not structured as organizations like us, where you have big membership, which you meet 1 hour and again, and so which makes it a bit difficult to continue to work together. But we are still continuing to work together. We are trying to find ways of raising some challenges, and also the friends of tech, which are doctors, they are assisting where we get challenges maybe on the ground, where we see maybe a patient is sick and is not accessing services, to say, okay, what can we do? Can you please assist us? But we feel like that is less than what we can do. If maybe it can be a bigger campaign, we feel like we can save more lives. And if like your cancer equipment can be made available to almost every hospital, I think more lives will be saved, because some people, they are dying unnecessarily. Their death could be prevented by accessing services earlier. But because it was made to be so expensive, the cancer treatment, the cancer machinery and all those things, that's why people they cannot afford to go private hospitals and afford those amounts that they are charging. So which makes people to die. That is why the issue of IP, we cannot live without it.
Absolutely, absolutely. So a question, Sibongile, submitted by Maza. A recent study published in the South African Medical Journal found that people with HIV and TB may also face a heightened risk of death from the new coronavirus. And you touched on this briefly, but if you could expand a bit, do you think enough has been done in terms of messaging, access to information, PPE and care to address the increased risks that our comrades living with HIV and TB are experiencing? And if not, what do you think are some of these low-hanging fruits that could be achieved?
I don't think there is enough messaging on that, and I don't think there is much said that was said around COVID and people living with HIV and TB. And at that, we felt ignored or not catered for, or people like government felt like now because there is COVID, they should all focus on COVID because there is money, there's funding for COVID. And for us, people who were living with HIV, they didn't even care to say, how are we accessing treatment? What is the messaging that is sent to pure people on the ground, especially those who are living with HIV and TB? What I think should be done, honestly, remember, I'll continue to refer to the history of HIV. For us as a country to be where we haven't won the fight, but we have made a difference, and we have gone so far. So for us also to fight COVID, we need to be inclusive. We need to work together. The government shouldn't sideline other people who are living with other chronic illnesses, because at the end of the day, it will be the burden to the government or to the public healthcare system. Hence, we are seeing now that since the lockdown, it has exposed our healthcare system to say how bad it is. And we've been saying this for years, to say our healthcare system is in crisis, but nobody listened to us until now, when it was obviously exposed now that they cannot cater for South Africans, they cannot cater for people who are in South Africa. So that this needs us to work together, and government needs to listen to us as people on the ground. If they can start to listen to us people on the ground, because we have more experience, we might the PhDs and what, but at the end of the day, we have the life experience of how are we accessing services. I know for a fact that how it is to live with HIV, and I'm sitting here, I'm scared that if I may be infected with COVID, what will happen to me? So I will try to make things right and try to get the messaging as much as I can as a person who's affected. So they shouldn't leave us behind, while their slogan all the time, they're saying leave no one behind, but all the time we are left behind. Like even now we felt like we are left behind, and they were doing their own things. Now because they are failing and they're done chowing the money, now they want to come back to us and we should come up with possible solution, which I don't think it's fair. But because we want to survive, we want to live, we'll continue to work with them.
Absolutely, thank you. A question submitted by Anna says, what are your thoughts on the recent South African study that found that a substantial number of women with HIV became obese on the newer antiretroviral drug regimens? Do you think this is a cause for concern?
Yes, I think that is a cause for concern. I'm a living experience of that. I switched my treatment in February this year. And I thought maybe now I'm gaining weight and I'm becoming obese and things. I thought, oh, maybe stress work, I couldn't think. But after I've learned that TLD, one of the side effects, it's obesity. That is very frustrating because all of us, that obesity can cause other illnesses. So if women who are living with HIV take TLD and causes obesity, it will mean we'll have more women who have gained weight, which they are not comfortable with. We know women will like to be a bit skinny, we want to be sexy and all those things. But there are those women who appreciate to be bigger and but everyone has to have a choice at the end of the day. How do I want to look? I don't have to be forced by medication to look like this. Remember the days of Tavudin, how it was deforming people and how people looked at that time. So we don't want to go back to as much as we need new inventions. We need more medication, better medication with fewer side effects. At the end of the day, it's concerning. But then that is a discussion that we still have to talk about as women who are living with HIV, to say, what do we think about this? Because at the end of the day, it will mean that most of us who are women and majority of people who are living with HIV will be left without treatment and will be left stranded. And what will then mean to our future generation and our communities? Because without women, there's no community.
And of course, we've seen the hugely increased vulnerability of people with obesity to COVID. So Sibongile, can you just share, and this question is also directly linked to Richidze, which I must say I'm sure you're all very proud of and should continue being proud of, because you are increasingly hearing this narrative of community-based monitoring, community-based, especially in the last 3 or 4 months, even in the region. And so, of course, it's yet another example of how tech has pioneered some of these interventions. So the question is, we have seen over the past week, tech has been monitoring some healthcare facilities in Port Elizabeth, and of course we know this is actually nationally, that has helped the provision of services given to people who were forced. Has that helped in the provision of services given to people who were forced to stand in queues outside clinics? So are we already at this fairly early stage seeing the impact of Richidze and how communities experience services at community health centers?
Yes, if I may talk to the experience of PE, it has helped a lot. As I've said earlier, to say we continue now to have engagements. It has taken government officials out of their offices to work on the ground. We have constant visits with them to the facilities, talking to patients, and the healthcare services in those facilities that were identified. At least it's improving now because there is something that is happening, and there was advocacy done. So yes, it's being a lot of impact and advocacy on the ground, because when we see things that are not going right, we just attend to it there and there, and we try by all means to say it's getting solved. And it has opened doors for us to be able to talk to big funders like your CTC and USAID, which are influential to the government. So even the government, because they don't want to lose PEPFAR funding, they are towing the line. So it has worked on our advantage. But most excitingly with Richidze is that it has given people living with HIV opportunities, people on the ground, because majority of people who are field workers of Richidze project are people living with HIV, are women, and are coming from the poor communities. So there is a lot that is happening, which it's very exciting when you talk to Richidze.
Yeah, absolutely. Thank you. You know, you spoke about what has been happening in the Eastern Cape, and I mean, I think that's heartbreaking for so many of us, just seeing this constant narrative from that particular province. But specifically, when you spoke about community members being shot at by police, it made me think about tech's role within the region. And certainly we're seeing this uprising of young people, whether it's Nigeria, Zimbabwe, activists being arrested in Uganda. Could you speak about some of the lessons that the TAC has taken from these very localized issues and very clear instances of government and its heavy hand on its citizens, and how these are applied, if at all, in the region? Does tech have a presence in the region, and what does that look like?
Unfortunately, we don't have a presence, but we have partners and supporters, which we always in contact with them. For an example, we have our comrades in Zimbabwe, which we always talk to them and they give us a snapshot of what is really happening in Zimbabwe. And lately we've been thinking of a way of supporting comrades in the region, Zimbabwe, Nigeria, and other countries, which we see that there are still a lot of challenges and there's a lot of police brutality. We know even in South Africa there is that police brutality, but it's not like in other countries, as you stated earlier. So, which is very disturbing, especially, you know, Tian, when most of these countries are liberated countries, and you come to ask yourself to say, we were liberated to be abused. What should we do actually? Because if I'm raising my voice to say I need these services, and somebody decided Sibongile has to die just because she has a loud voice or she's making so much noise, that is violation of human rights, and that is disrespect of human rights. So I think as activists in South Africa and activists in the region, we need to now start, as much as we have that partnership, but we need to stop to have this formal partnership. We need to have informal partnership where we'll be able to talk daily to say, this is what is happening. And if we are seeing this happening in this country, we go to Nigerian embassy and say, stop this now while we are here in South Africa. But you know, these formal platforms, they tend to formalize more of the things of which it drags the process. So I think now, as a region, we need to call for informal civil society and see how do we support each other from one country to another.
Absolutely. And I'm excited that call is being echoed by leaders like yourself. I think if you look at the amount of time that is spent on developing MOUs and log frames, people are losing their lives, people are not accessing treatment. So I'm a particular fan of that concept of informal partnerships. Speaking about partnerships, perhaps a heavy issue, and I know it certainly has sat on a lot of our hearts and our souls, because a lot of us do this work because it's who we are and we cannot even think of doing anything else. Comrade Diola has posted a question. How does tech view the state of civil society unity in this country? Are there missed opportunities because we don't have a united front? And what do we need to do about that? It's an elephant that has been in the room for decades, and for a whole basket of reasons, it hasn't really been addressed or taken on, whether it's funding reasons or political reasons or individual ego reasons or personality clashes or whatever it is. As a leader of an organization that has been lauded globally as almost the gold standard of activism, of bringing communities and people together, what is on your mind? What is in your heart about the state of civil society today?
I want to be honest, Tian. This is always in my thoughts. Let me start by saying, as TAC and PHIV sector, if you listen to me, I kept on referring to PHIV sector, which it was something that was not happening for a very long time. So we decided to say we want to be united and we want to put our differences aside as people living with HIV, because we saw that people have, or government and other structures have taken advantage of us because they could see that we are not united. They will go to other group and say this group is or things wrongly because of this, and made you believe that this thing, that whatever is happening, it's not right. But at the end of the day, we are fighting one enemy, which is HIV. So we started to say, how do we unite the sector of people living with HIV? As I'm taking to you now, yes, we have challenges within the sector. We have our differences at some point because we are human beings, but we always find a way of working together, and we agree, we disagree to agree at the end of the day, because we all know what we want. And I feel like that is a starting point to say we need to understand each other first. You need to understand that how is TAC working? How is NAPA working? How is PAC, Positive Action Campaign working? PWN, Sanarela working? So that it should be easy for you to understand, to say, okay, this is how they do things. This is where we fit in as an organization, and we can be able to be united. That is a starting point for us, and we think that it will grow. As we are talking about reaching a successful project, it's because of the unity of people living with HIV. So TAC cannot take a credit alone. It's a unity of people living with HIV. Going to the broader civil society unity. Yes, it's okay. We need to be united, actually, but also we need to hold each other accountable. But the way we hold each other accountable at some point, I feel it's wrong. I think when we hold each other accountable, or want to understand what is happening from one organization to another, we need to be respectful of that, and we need to engage the affected organization to say, this is what we hear. What do you think? Where can we support? Where can we come in? If we can use that strategy, it will be easy. But now what we are seeing is that every organization, it's waiting for another organization to make a mistake, and then we run to social media and shout about that. I don't think that is how we are going to build unity within civil society. And also we need a civil society that has heart, has love of people at heart, and love people from the ground and honestly love people. What makes it difficult for now for us to work together is that some of the organizations, they are only after funding. But if there is no funding, they cannot do anything. People on the ground are left stranded. And some, the corruption that we are talking about on the side of government, the unfortunate part, it's happening within civil society. And because we are in the space, people, they want us to be like, okay, it's okay because it's you, comrade. No, if your comrade is wrong, it's wrong. But let us not take everything personally. Let us try to work together to say, okay, you have made a mistake. Yeah, this is how you were supposed to implement this, but you did this. How do we come in and support you in order to do things right? I think by doing that, we will be able to be united as a civil society in the country. We have seen that starting to happen when the lockdown started, when the C19 People's Coalition was born. And I was very excited to say, this is the first all organization of civil society in one room. We are talking same language, although others are focusing on grant, others are focusing on economical status, others are focusing on health and other issues, gender-based violence. But how do we take that strategy and move forward? Which is unfortunate because along the way, yeah, the thing of being of want to be there and known that I'm leading. All of us, we want to lead by being exposed or by being popular. That also kills our unity as civil society. So there are a lot of missed opportunities, if I might talk about. The opportunity of engaging government recently on the issues of COVID-19, we missed that opportunity as civil society. There are a lot of fights that we could have won together. The issue of funding, irrespective of which funding, it could be HIV, it could be SRHR and others. I think we could have won the issue of funding because there are organizations that are closing down now and again because of funding. But if we were together, we could be able to say, how do we advise each other so that people, they can report the way they are supposed to report, or how can they use money adequately so that they can be able to sustain their organization. So those are the missed opportunities, which I feel like if we're and working together and allow ourselves to be criticized in a respectful way, we could have been far. Thank you.
Yeah, thanks for that. And I think one of the things that has stood out to me, certainly in some of the engagements, was this constant refrain around how people who had never thought they would work together before COVID are now finding themselves working together. And then a second point I take away from what you said is just that power of humility, the power of service, serving the communities that we have, platforms that say we serve those communities. And what does that actually mean? So thank you for those reflections. We have 5 minutes left and I have 3 more questions left. I'm going to ask you, could you just share with us what to date would you say has been TAC's biggest challenge, and what to date would you say has been TAC's biggest success that you are proud of? So your most difficult moment at the helm of TAC and your proudest moment. And I'm sure there are many, but if you could just give us one each.
Okay. Today's challenge in TAC, I'll be honest, it's an issue of leadership. We have a big challenge on leadership, and yeah, we are working very hard to try to build a next layer of leadership. Poverty has taken over, where people feel like they will use organizations like TAC to expose themselves, and then after that they leave the organization, which is okay. But then how do we sustain the leadership within the organization? And poverty, it has exposed people to so many platforms. Remember, when you're a member maybe of TAC and you are a leader in TAC, you'll be required to go and sit in those structures like your district AIDS council, provincial AIDS council. You'll be taken to fancy hotels, which you cannot afford. You'll be given that 108 or 250 a plate, which you cannot afford. So then your loyalty now tends to shift from what you joined or from what the organization mandate is, and you want to associate with people who will open opportunities for you. So that's the biggest challenge that we are facing. Successes. A lot of successes. I think, if I may just say, for now, I will talk about Richitse. It's our success, which we are very much committed as TAC in Richitse, and we are putting 101% energy onto it. Yeah, so far it's our success. Also, another success that I'll never forget, we have more young women within the organization now who are part of TAC, and who we feel like will grow to be better leaders in the near future.
Absolutely, thank you. I think something we're both excited about. And I think your issue of leadership is also, again, an example of how tech is tied in to what is happening globally. One of the funds that I serve, we've just launched our 5-year strategic plan. And our sole focus in the next 5 years is funding and supporting new leadership. Because it's that political recognition that, I mean, you are clearly so young, but the rest of us are quite old, and we've been doing this for what feels like forever. And you wonder, where are these fresh ideas? Let's create and support that space. So I think certainly very much in tune. It's a few minutes to the top of the hour. I'd just like to give you a few minutes to share with us. So as Sibongile Tshabalala, in this space, there's politics, there is backstabbing, there is agendas, there are egos, there are resource battles, there are battles for space. Once all of that is set aside, and when hopefully at some stage you get home and you have a chance to breathe, or when you wake up in the morning, what keeps you going? It's a question that is asked over and over, but what really keeps you in this space? What drives you to keep on doing this every day?
Honestly, I'm from a family that is so, my parents, they love people. When you come to my parents' house, every time there are visitors, we don't have time for us as a family. So I grew up in that kind of family space. And I have a lot of support from my parents, which I cannot thank them enough. And the love that I have for communities or for people on the ground makes me to wake up even if I don't want to wake up. It makes me, every time, sometimes I will come back and say, no, I'm done. It's over. I cannot do this anymore. I'm tired of everything, and I want to switch off my phone. I want to shut off and be in my own space, but I can't, especially when you are in the community that I'm living in. I don't want to relocate here because it always connects me with people. When you are in my house, my last row, it's my house, and the back of my house, it's informal settlement. So every time I want to go, I even open the gate at the back so that when I want to go, and I just go there and see how people are living and how are struggling. And that tells me that, Sibongile, you haven't done enough. So you have to wake up and do something. So that drives me, that makes me to wake up even if it's hard. The love of the people and to want to change people's lives and give people, communities, better life. I know I cannot do it alone. We have to be together and we need to work together. But I believe that one little change means something, and that makes me to sleep peacefully at night at most times.
I really enjoy how our conversation has been characterized by love, by service, and by humility. Colleague Sibongile Tshabalala is the national chairperson of the Treatment Action Campaign and a valued partner in these COVID-19 conversations that we hold every week, Thursdays at 10 a.m. Sibongile, thank you again. Colleagues, Thank you for joining us and spending your Thursday mornings with us. Next week, we hear from the world's largest network of COVID vaccine trials, CoVPN. They will be updating us on their work and how that global work is being rolled out in South Africa. So thank you to everyone for participating and spending your morning with us. And again, Sibongile Tshabalala, thank you so much for your time, and we wish you all the best in your work at the helm of TAC, and have a great Thursday further, everybody.
Thank you. Hey.